Ladies and gentlemen, welcome to Chentex Multimedia, live streaming directly to your device all the way from Brisbane. Well, Brisbane, which is in 3-day lockdown. Yes, 3-day lockdown right here in Brisbane, as that notice there from Brisbane City Council. And of course, lockdown began at 5 p.m. yesterday, and it will continue for the next 2 days now. So today we will be joining our Premier with the live update to see what's happening out there. And of course, we will be covering the event throughout the day. And if there need be, and if there is very important updates, we will go live again during the day or just before finishing up for the day. But at the moment, the lockdown has begun, and this morning, the streets are quiet once again, and very few cars out and about. Of course, as per the rules and regulations, only essential workers and limited number of people to go. So what's happening here in Queensland is the coronavirus cases. We've got 8 local cases and other 2, so the number is about 10. Active cases in Queensland at this point in time is 78. And total confirmed cases was 1,466, and so far the deaths have been 6. So the test in the past 24 hours has been 14,589, which brings our total to 2,162,250. And patients that have recovered is 1,343. So that's the update. So those are the key figures and facts that Queensland government is working off. And of course, when you look at those numbers, what the chief health officer has done when the directive that's been put in is quite timely, coming into Easter. So there's 4 days of holiday there plus this one, so extended. We will be able to get over this in a very, very good manner if everything's observed and done properly. Well, right now let's take a look at what weather-wise, what the weather has in store for us during this lockdown. With that, let's welcome to the Dilraj.
Good morning, everyone. Weather forecast for the rest of today is maximum 26 degree. Brisbane area is partly cloudy with medium chance of showers, most likely in the late morning and afternoon. Wind southerly 15 to 25 km per hour, tending southeasterly 20 to 30 km per hour in the middle of the day and then becoming light in the evening. Fire danger is low to moderate. Sun protection is recommended till 3 p.m. and UV index is predicted to reach 8, that is very high. Till tomorrow, stay safe and enjoy the rest of your day.
Thank you very much for that update, Dilraj. And as Dilraj said, let's all remain safe and observe those safety rules, because it is very, very important that all the rules are observed, and don't forget those masks at any stage. Moving out of the house, you need to, of course, take your keys, wallet, and never forget the masks. And this is for the better of everyone, to safeguard everyone, to protect everyone. So it is very important that we do that. Well, right now, when we move on, there's so many different things that we're going to be talking about today. But first of all, I'd like to see if we can bring to you Queensland Health and what's happening with the current situation there. As we know that what's happening is that the lockdown, and under this lockdown, there are many things that you can do and there are many things that you can't do. So, what are the things that you can do? Let's take a very quick look at the updates right here. So, the active cases, as I said before, 10 active cases. There was the 8 plus 2, and total number of cases were 1,456. So, now in Queensland at the moment, mask is mandatory for, greater Brisbane. So you must carry a face mask with you at all times when you leave home, unless you have an lawful reason not to. You must wear a mask indoors spaces such as shopping centres, supermarket, retail outlets and indoor markets. Toilets and aged care facilities, hospital venues such as restaurants and cafe, well, it is not required for patrons while they are sitting, but customers facing their staff must. Churches and places of worship. So if you're going to a church or a place of worship, masks are mandatory. So here, many people have been asking about churches, mandirs and temples and saying what's happening in that scene. You can go with that restricted number of people. You must have the mask on, but we have received notices from most of the mosques, temples and other things that as per the COVID notices that for the next couple of days they will remain closed. Most of them, not all. Libraries, of course, as well. Indoor recreational facilities like gym, except for when you're doing a strenuous exercise. And indoor workplaces must wear masks, and if you can't physically distance and there's more than 2 or 3 people in a place where there's only 2 people on a regular basis, that's different. Public transport, taxis and rideshare, including waiting areas and queues for this transport, airports and traveling on planes. It is strongly recommended you wear a mask when outdoors if you are unable to stay more than 1.5 meter away from other people, such as busy walkways and thoroughfares. So it is advised just to wear it. Simple as that. You can't say that I'll be away. If you outdoors into public areas and places, just wear the mask. Masks do not need to be worn in some circumstances, including children under 12, where people have certain medical conditions, and workplaces where it is not safe to do so. You can remove your mask to consume food and drink. And of course, while you on a news reading show, you too can. So the Greater Brisbane 3-day lockdown, so from 5 p.m., which has begun from 5 p.m. on 29th of March, people have been in Greater region from 20th March will be subject to home confinement restriction. The impacted local government areas are City of Brisbane, City of Ipswich, Logan City, Moreton Bay region and the Red Regional City. So if anyone has been in these areas on or since 20th of March, now remember the lockdown began on 29th, but this notice goes to 20th of March. The restrictions listed below will apply. What are those restrictions? In and out. People in the impacted local government areas will be required to stay at home except for essential reasons. Visitors to aged care facilities, disability accommodation and correctional facilities will also need to remain in there. People can leave their home for permitted purposes accompanied with people from their household. So these are the things, and right now we will go and join with our Premier to get the Premier's live and see what's been happening out there on the in the updates that she normally puts out, and let's look at what's been happening and what are the updates for today. And very soon we'll be joining our Premier with the live, as we know that she went live at 9 a.m. and we thought we'd bring that to you a little bit later for people who would have missed that segment, that they could join in with our segment now. So right now, let's go and join with the Premier's live segment for the live update for today. Yes, we're ready. Yes, we are ready to start.
Six are close contacts of confirmed cases, and 2 are currently under investigation, but we believe that they are also linked to the 2 people. So 2 are also overseas acquired and once again coming via Papua New Guinea. So we now have 78 active cases of COVID in our hospitals. We've had 14,508 14,589 tests in the last 24 hours. And can I thank Queenslanders for coming out and getting tested. This is absolutely critical. If you have any symptoms, now a lot of people in the Greater Brisbane area are at home. If you have any symptoms, now is the time to go and get tested. We need to rule out any further community transmission. But the good news is that these cases are linked, and we now believe that there are two distinct clusters. So we have a cluster linked, of course, to that PA doctor, and we have a second cluster linked to the PA nurse. So close contacts of both of those clusters, and Dr Young will go into more details. Now, as I said this morning earlier, and I'll say it again, the majority of our cases are, of course, from overseas, hotel quarantine, but our hospitals have 78 active cases at the moment. Now, if we go back to the 20th of February, we had 5 active cases. So from the 20th of February until now, so just over a month, we have gone from 5 up to 78, and 63 of those, 65 have been overseas acquired. Now, of course, we want to get on top of this community transmission. So the steps that we took to go into this lockdown, as you can see by those numbers of community transmission today, was absolutely the right call. So I want to thank Dr Young for providing us with that advice. Now, there will be some new mandates coming into effect in terms of health professionals dealing with these COVID positive cases that Dr Young will talk about, but already 41,000 of our frontline health workers and people looking after hotel quarantine have been vaccinated, which is around 89%, and we expect that to be completed over the next 48 hours, so in terms of getting that first vaccine. So the rollout of the vaccine has been happening, so I just want to reassure Queenslanders about that. But I'll now hand over to Dr Young, who can give you some more details. Of course, there will be further lists of venues as our contact tracers go into overdrive to really look at where people have been. And I want to thank each and every one of them because they are doing an outstanding job. But Dr Young will now go into more detail about these two clusters and give you more details. Thank you.
Very much. So we've had 10 new cases overnight. 6 of them are locally acquired cases. 5 of them related to the second cluster, which I'm going to go into detail in a moment with. 1 we're still working out which cluster they're related to, but we know they are a contact of a case. So we have 6 linked locally acquired cases, which is good. They're all linked. Then we have 2 cases that were acquired overseas and detected in hotel quarantine. So both came from the Philippines via Papua New Guinea into Queensland. So they're fine and being managed. Then we have 2 other cases that are under investigation. So we're just working through those cases. We believe they're older cases linked to the first cluster. So now if I can go into detail about these 2 clusters. So the first cluster is related to that doctor at the PA hospital who treated a confirmed case, and you would remember that she acquired it from a confirmed case in the hospital, and also that case had passed it on to another traveller in the hotel when they were in hotel quarantine. So there were those 3 cases earlier in March, 12th of March. Then since then we now have these new cases that we picked up in the community, and I'm very grateful to that first young man who came forward and got tested, and the second gentleman, so they live in northern Brisbane. So those 2 cases, then we've had other cases connected to those. So, and we know they're all linked because of the genome sequence. They're all a B117 linked back to that case at the PA hospital. So we have that cluster. Then we have a second cluster, and this is the nurse that I told you about yesterday. So she worked at the PA hospital on the 18th of March in the COVID ward. But we now have the genome sequence result back due to some fantastic work by our pathology staff. They gave that result to me last night, and she has exactly the same genome, no SNPs different, to a gentleman who arrived and was treated in the PA hospital and was tested on the 22nd of March. So after the nurse worked in the COVID ward. She did do a shift on the night of the 23rd of March. So that shift started 10 p.m. that night. She worked through the night into the next day on the 24th. So my hypothesis, and this all has to be tested, this all has to be checked out, this is very preliminary information, is that she has acquired the infection when at work that night. Now, I don't know whether she's got it directly from that patient because she wasn't working with COVID cases that night, but we have to confirm that, or whether she's got it from someone else in the hospital. All that has to be worked through. But we do know she's got exactly the same genome, so we can't find the epidemiological link at this stage. That's the work we are now doing. So she has got it. Then her sister has got infected with the same genome. So we have that genome sequence result last night as well. So we have the nurse, her sister, and that overseas traveller, all with exactly the same genome. Then there are a further 5 cases that I've been informed of overnight linked to that nurse or her sister. So they're all linked cases, and they all attended a party together down in Byron Bay. So we're just working through all of those specific details. This is very recent information. So we have those 5 cases linked to that nurse. So we now have 7 in that cluster. Then there is another case. Remember I told you there were 6 new cases overnight, community acquired, 5 of them linked to that nurse in that cluster. Then there's another case that I still need to get more information, but I've been told is a close contact of a known case. So we don't have community transmission out there that we're not aware of. At the moment, all of our cases are linked to either the first cluster with that doctor who worked at the PA, or this second cluster, which is a brand new cluster unrelated to that first cluster, linked to the nurse who's worked at PA. So we understand all of those movements. But we've had a lot of people now out in the community infectious. So that's why we need this 3-day lockdown to get on top of all of the contacts of all of these positive cases and work out where they've been, and having everyone in their home instead of out and about in the community just helps us get on top of all of the contacts and minimise the risk of further spread. But we know we have had infectious people in the community, so that is why it is absolutely critical that anyone, anywhere in Queensland, because we do know that some of these people have left Brisbane, so it is vital, anyone in Queensland with any symptoms, please come forward. That is critical. So we have seen that happening across the state, and we have seen a rapid escalation in testing numbers, which is fantastic, so we can find if we've had further spread anywhere.
Sorry, a little bit confusing.
It's very confusing. I apologise. It's extremely excusing.
5 cases who mixed with the nurse and their sister environment, are they Queensland?
Yes, they're all back in Queensland. They are all in Queensland. So I spoke as late as this morning to my colleague in New South Wales to go through all of that. My colleague in New South Wales, Dr. Chant, is working with her team in Byron Bay to make sure that they're sorting out all the venues there and contact tracing.
And you said there was one other case of close contact with the nurse?
I don't know. I've got to get more information.
Well, 2 others, because the Premier said there were 8.
Yep. So there are... Yep.
Number 1.
Thank you for bringing that up. You've been listening very carefully. So there are 2 cases that I believe at this stage, but I do need more confirmation, are linked to the first cluster, and they are positive on serology. And people might remember that serology is not an exact science. You do have a lot of cross-reactivity, so we've just got to do some more work on those 2 cases. They're PCR negative, so they are not currently infectious, but they are reactive on serology, and they are close contacts of people involved in the first cluster.
And the other outstanding one, we don't know which cluster that is.
No, we don't know, but we know they're a close contact. You're getting this information almost at the same time I get the information, which is why I apologise I don't have all the answers.
So to confirm, the 2 cases were started by 2 separate return travellers in hotel quarantine.
Correct.
Included at the hospital.
Correct.
One of those people was at the hotel quarantine, so where was the other person quarantined?
I don't have that yet.
And are you concerned that there's been more spread within that hotel, like is there in
That's all the work that we now have to do. So I found out about this. It was a little bit of a surprise, but as I said yesterday, until we got the genome sequence, I couldn't be certain how that nurse had been infected. And then I got that late last night.
And are both the UK strain? Both
Yes, very good question. They are both clusters are B117, or commonly called the UK variant, but they are very, very different. They are not related to each other. They are 2 different virus genomes.
So the 2 clusters, can you say like the case number for each cluster?
Yes, I can. So I've initially got 3 cases related to the PA doctor back earlier in March. Right. Then I've got an additional 5 cases that are confirmed that are related to that cluster. Then I've got 2 more cases that I'm investigating that I suspect are related to that cluster. Right. So that's 1 cluster. Then my second cluster, I've got 7 confirmed cases related to that cluster, plus, of course, the original case who travelled from India. That has led to that cluster, so 1 plus 7. Then I've got another case that's one or the other cluster.
Correctly, March 18, the nurse working the specific COVID ward, is that right?
Sorry?
So on March 18, the nurse worked in a COVID
Yes,
ward.
but I don't think that is the cause of her infection. In fact, I know it's not.
Yeah.
So it's not that shift that has led to the infection. It's when she worked there on the 23rd.
Sure. Having said that, 89% of frontline workers vaccinated. Is it best practice for nurses who aren't vaccinated to be working in a COVID?
So as of tomorrow, I will mandate, as I've been saying now for several weeks, to the hospital and health services that only people who've had their first dose of the vaccine, whether it be Pfizer or AstraZeneca, can work directly with confirmed cases of COVID.
What?
Yes, and that was always our plan. So we did set ourselves that target for between 4 and 6 weeks to get all of 1A workers vaccinated. We've reached that. We believe we'll finish that by tomorrow. And then the plan was always, once we had people vaccinated, because we needed to have people available to look after all these cases. And as you heard earlier, we've gone very, very rapidly from 5 cases in just over a month to 78. So we need staff to look after these cases, and I'm very grateful to the staff who have been doing this work. Of course I am, and all of us are, and now all of those staff will have had the opportunity to be vaccinated, so it will be mandated that only vaccinated staff can work directly with COVID positive cases.
Why wasn't that the mandate from the beginning?
Because we didn't have enough vaccine. We had to roll the vaccine out. It's just so unfortunate that this outbreak has occurred when it did. Another month and all of these staff would absolutely have been protected.
She definitely wasn't in the COVID ward on the 23rd.
She wasn't managing COVID cases. There's a difference.
So how do you suspect she got it then?
I don't know. I found this out late last night. That is the really important work that the staff are all doing today.
Is there, so you've been calling on the health services to be mandating this only if you've had the first jab. What's happened there? Is the PA taken that advice and not acted upon it?
No, they've done their best to do that. But as you've heard, the numbers of cases has just ramped up at the same time as we're trying to vaccinate people. So we've had to then vaccinate more people. So we started with a smaller number in 1A, and that number has increased. because we've seen this big increase in case numbers. So the PA has been doing an absolutely first-class job, as has all of our hospitals.
Is there a concern that PPE use at the PA given that we've got the two clusters?
No, there isn't a concern, but of course we are looking at this and how it's happened. But as I said before, I don't know how the transmission event, because it's too early to know. It's not because we haven't looked, it's just too early. So I found out very late last night the genome sequence result. That was quicker than I thought. I thought I'd be getting it this morning, so they've done a first-class job there. And finding that out last night, we've then been talking to the HHS to go and test all the staff in that area to see if there's been another case or if there's been direct transmission from the patient to this nurse.
There is a report this morning about a contractor who's tested positive visited the Gold Coast nursing home.
That's correct. Yes. So one of the
one you don't know about.
No. Thank you for raising that. One of the positive cases in that second cluster attended the Hens party as an entertainer, and he came back and he lives in the Gold Coast and he works as a tradie, and he did go to an aged care facility in the Gold Coast. But every...
Gentlemen, there you are, the update, and let's quickly hear from our Premier as well on those cases, and she provides that update. And as we know about these two different clusters, as Dr. Jeanette Young has been saying, but both of them are the UK virus, as they say, and most of the cases, though acquired locally, have originated from overseas. They've come in by people coming in. As we know, there was one person who came in from India, the others were from Papua New Guinea. So most of the cases originated or have been brought in from travellers from overseas, but it is now our duty to control that. So here's the summary from our Premier.
Now, 8 of these are community-acquired cases, 6 are close contacts of confirmed cases, and 2 are currently under investigation, but we believe that they are also linked to the 2 people. So 2 are also overseas acquired, and once again coming via Papua New Guinea. So we now have 78 active cases of COVID in our hospitals. We've had 14,589 tests in the last 24 hours. And can I thank Queenslanders for coming out and getting tested. This is absolutely critical. If you have any symptoms, now a lot of people in the Greater Brisbane area are at home. If you have any symptoms, now is the time to go and get tested. We need to rule out any further community transmission. But the good news is that these cases are linked, and we now believe that there are 2 distinct clusters. So we have a cluster linked, of course, to that PA doctor, and we have a second cluster linked to the PA nurse. So close contacts of both of those clusters.
So close contact of both those clusters, as I mentioned before, that there's the 2 different clusters that the government's been working on. The good part is they're known, and you can go on the website and find out a whole list of locations that these people visited. That if you had been to any of those locations, you need to get tested. And if you have any doubt at all, please go forward and get tested. Right now, let's take a commercial break.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
And real estate is the world. And don't forget that tomorrow we'll bring a real estate update with Usha Chandra of GlobeNet Realty and looking at the markets and what's happening, and especially coming into this long weekend, Easter, what's going to be happening over the auctions, the open houses, what are the situations with the inspections at this point in time. There's so much to talk about. We will do all of that tomorrow. Well, right now let's go and look at some of the events as we talked about before, but today we are going to look at Viswa Hindu Mahaparishad and their function together with HOTA, which was part of Sahyog. Sahyog was a group of organizations who all came together to support international students or anyone, in fact, in need during COVID original lockdown, the first lockdown, around this time last year. So let's join and have a look at that. The function was held at the Queensland Vedic Cultural Centre in Leroyd Road, Willawong. And of course, it was attended by many participating organizations. And during the course of the events, certificates were handed out to all the supporters who supported the event, and who came together to provide support. And Professor Sabadanam Singh did the honors of handing out the certificates to a lot of volunteers who assisted with that. Rohani is there receiving her certificate as well. So many people, Pushpinder Roy receiving his certificate there as well. So many people who had helped this wonderful cause. And of course, you can see the social distancing when everyone's sitting there, Tamil organization there, everyone were then treated to a beautiful vegetarian meal provided by Sankalp. And it was good to see that everyone coming together and which was part of Sahyog. And of course that their efforts have been recognized by Viswa Hindu Parishad of Australia's Brisbane branch. And of course all our community supporters like John Presco and that's Beth Swaminarayan Temple was represented there as well. Tamil Association was represented. Brisbane Indian Times and Australian Indian Radio was there as well. So it is good to see the community coming together in appreciation of the good effort that had been put out by everyone who was behind the scenes, who worked really hard to make that event, Sahyog, very, very successful. And it was very good to see that everyone joined in, and it was very, very nice. Well, right now, there are a lot of cancellations as well. As we have received notification from Lakshmi Narayan Temple that until further notice, they will be closed. Of course, Gayatri Mandir from Hindu Society of Queensland, situated at 178 Lyndhurst Road. We know that every Tuesday night we have the Ramayana there and the Tuesday night prayer meetings. That is on hold until the further notice, until we get clearances. So that has been put on hold. And I was speaking to Sanjeev Sharma from Divya Jyoti Jagriti Sansthan with the Bharatiya Nav Varsh Mela, and that is under consideration at this point in time. So are many other functions and events as well. Queensland Sangeet Mela Association, and they function on the 10th at the Finnish Hall. Once again, they believe that everything might be okay, and they will still go ahead, provided everything, we get the all clear after these 3 days of lockdown and no new cases are, forthcoming, or we don't hear of any more new cases. So there are quite a few functions and events that have been taken on. But right now, we, as I mentioned before, if there are any further updates and if we feel the need that we need to come on live again, we will during the course of the day, or maybe just before the finishing off for the day, we will once again bring to you some live updates in the community interest if there is a need for that towards the end of the day. But it's wonderful to see that everyone are taking this responsible move and showing responsibility, acting responsibly. Of course, you will always have few people who come out and not do the right thing, but generally everyone's doing the right thing. thing, and if we do the right thing, maybe we'll get some good news in a few days' time, and maybe everyone will be able to enjoy the Easter, or some of the plans might go ahead. Of course, we know that many of the plans have had to be changed. And of course, the good thing would have been for people who would have arranged their holidays, or even if getting away, as long as they were within Queensland, if they're not crossing the borders. As we know, that Western Australia, Victoria and New South Wales have identified Queensland as a hot spot, and they have closed their borders to Queenslanders. So at this point in time, if you have planned anything for Easter, you would have been a very wise person if you would have arranged something within Queensland. But at this point in time, these are the facts as they stand. Things may change any time. As you know, anything could happen and something could change. So at the moment, we are in the 3-day lockdown in Brisbane, and the lockdown is for Greater Brisbane, which came into effect on Monday 29 from 5 p.m. Residents in Brisbane, Logan, Moreton Bay, Ipswich, Redlands can only leave their home for these reasons: to buy essentials like groceries and medications, work or study. If you can't do either of that from home, exercising in your local area, healthcare, or to provide health and care and support. But masks must be worn everywhere outside your home as soon as you leave your home. Of course, this is the summary, and when we look at the key figures, is the local cases 8 and other sources are 2, and active cases 78. Total confirmed cases 1,466. So, these are the key facts and figures and findings. So, ladies and gentlemen, until the next review, stay safe and do the right thing.